you are overwhelmed already. There are lots of the government control their population. The only way this can be achieved is when the families are able to plan the number of children they have. By so doing, the country can be able to plan for the number of indigents or citizens they need to have. In some countries where family planning is not used, there is population explosion. And in those countries, limited resources cannot cater for everyone. And so poverty and a lot of other consequences occur. Let's talk about consequences when we come back. Let's talk about the myth. Let's talk about some of the misconceptions about family planning. I know you don't want to miss that. So, if you don't go away. See you in the next few minutes. Thank you. Hello, welcome back. We're still talking about family planning. Before we look at the consequences, and of course the myth and the misconceptions about family planning, let us talk about where you can get these family planning services and when you need to have a family planning. Where? Most public hospitals now administer family planning. You can also access family planning services in community pharmacies and patent medical vendors in Lagos and Kano State. But for other states, you might have to go to the public hospitals, whether private or public, whether primary, secondary, or tertiary health institution. So talk to your health provider, talk to your doctor if you need a family planning service. When do you think you need it? When you've had enough children that you need, then you need family planning so that you do not have unwanted pregnancy or you do not have a child that you did not plan for. The truth is, if you have a child that you never planned for, the odds are that your resources may not be able to cater for that child. And in most cases, that child may be neglected. So, to prevent that, please ask your doctor or consult your healthcare provider if you have had the number of children you need. Again, family planning is necessary when a woman has undergone cesarean section. According to our medical ethics, a woman who has undergone cesarean section is not supposed to conceive again at least for another 2 years. Because if she goes in for another cesarean section, the chances are that the procedure will be life-threatening. So in such situations, you may want to go in for family planning. So if you have had a cesarean section, talk to your doctor so that you can be able to space the next conception and ensure that at least you give another 2 years before conception. The last but not the least is, when a country wants to control its population, the country needs to implement family planning laws so that couples will understand the need to go in for family planning. Now you know where and when you need family planning. Let us talk about the consequences of people who do not want to take family planning services. Number one, for a woman who has undergone cesarean section, if she gets pregnant and she undergoes another cesarean section in less than 2 years, the procedure would be extremely life-threatening, and in many cases, the woman may die. Do you want to be a victim of that? No, you don't. So, if you've had a family plan and the CS before, please consider going in for family planning so that you can give yourself at least another 2 or 3 years before you go in for another child. Another consequence of family planning is that couples have children that they cannot cater for. And so those children either becomes vagabonds, prostitutes, armed robbers, because there are no resources to take care of these children. You don't want your child to go through this. So, plan your family very well, because if you don't, then you will have a failed parenthood. Another consequence is population explosion. In countries where family planning is a taboo, there is a population explosion. So they have too many citizens that they can cater for. In these countries, poverty is extreme, and in many cases, death of children and mothers are quite inevitable. We have realized that in countries where there is population explosion, like Nigeria, maternal and child mortality is very high. Healthcare services is quite limited, and the burden on public health care facilities is very high. The resources that are available are not enough. Youths go without having jobs, and there are not enough resources to take care of the population. This is a very looming consequence of family planning. Please, I want you to know this, that if you must ensure that we have a good country, that resources are sufficient for everyone, then you should be thinking of family planning. If you want to ensure that you have the number of children you can take care of, you should think of family planning. And if you want to ensure that you can space your children very well, think of family planning. What are those myths? What are those misconceptions? Some people believe that family planning is just a strategy by the United States and other Western countries to reduce the population of Africa. Do you believe it? I don't think so. Family planning really helps in most countries. I will tell you this. A country like Rwanda was able to move from a very low-income country to a middle-income country because they control their population. A country like China was able to move to first war country because they were able to control their population. This is one of the advantages of family planning. So why would we believe that family planning is just a strategy to reduce our population? The truth is, it is a strategy to ensure that we as a nation have the number of citizens that we can cater for. The number of citizens that our resources can provide. Please, do not believe any misconception that it is a strategy to reduce our population. No, it is only a strategy to control our population so that we can take care of the number of people that we have. Some people believe that once you have family planning services administered to you, that when you want to go back on it, you cannot. I tell you no. Family planning methods like implants, like tablets, like condoms, even the intrauterine device can be withdrawn at any time. And ovulation and of course conception can occur in a few weeks after such has been withdrawn. So there's nothing to hide here. Family planning is a very essential healthcare service that every couple should think of acquiring at some point in their parenthood. Now you know about it. Please try as much as possible to let others know that there is need for couples to go in for family planning to be able to control their own parenthood. Thank you very much. My name is Dr. Ekanem. I'll be back again for another interesting episode. Bye for now.
Welcome back. Well, thank you, Dr. Ekanem, for letting us in on all we need to know about family planning, the concepts, the benefits, the consequences, the myths, the misconceptions, and also when and where one can get family planning consultation. But on this note, we need to switch gears now to the last segment, which is health trivia. And on this segment, we are asking, share your experiences on family planning methods. You don't want to miss it. Don't go anywhere.
They have their own advantages and disadvantages. When I had my second baby, I started using pills because when I had the first one, I did not use anything. So after 9 months, I took in again. Despite the fact that I did CS for the first one, so I took in again, which was not that good for me. So I gave birth 1 year 6 months. So it was not actually okay, but thank God I survived it. So after that, I had to go on family planning just to, you understand, help me as a woman. So when I wanted to have another baby, pregnancy did not come. So I had to, see my family doctor. So who advised me on what to do and things like that. But it actually helped me because I had another baby, the third one, 4 years after, you understand, which actually helped me as a woman.
The first time I started collecting family planning, I got pregnant with the family planning. Then I rushed down to the general hospital. Then they checked be good for my health. So now I've not been having any problem with the one I'm using now. I think that one is okay for me.
Well, some of the family planning, most of the time, there are some that are not good for the body. That is, sometimes it makes you fat. Sometimes when you have it, you keep having your period. You keep having your period, which is not, it's not even good for the health. But I don't know why it's like that. But I know it's good.
Welcome back. Well, from that last segment, it's quite obvious that everyone's experience with family planning methods is different. But the most important thing to remember is that family planning methods are safe, easy, and cheap. Well, on this note, we need to call it a wrap on the program. I'm very sure you enjoyed today's segment. We'll join you again next week. My name is Folashade Ogunyi. Take care of yourself. Bye-bye.
Impact Africa Television